Welcome back to my stand-up channel. Here we go again. Gov. KathyHochul signed an executive order Friday to postpone elective hospital surgeries, something that hasn't been done since the worst of the initial coronavirus outbreak last year. Hochul said she made the move to deal with staffing shortages and boost bed capacity amid an anticipated spike in new cases and the emergence of the new Omicron variant in South Africa. The strain is named after a letter of the Greek alphabet. We've taken extraordinary action to prevent the spread of COVID-19 and combat this pandemic. However, we continue to see warning signs of spikes this upcoming winter, and while the new Omicron variant has yet to be detected in New York State, it's coming, Hochul said. In preparation, I am announcing urgent steps today to expand hospital capacity and help ensure our hospital systems can tackle any challenges posed by the pandemic as we head into the winter months. The vaccine remains one of our greatest weapons in fighting the pandemic, and I encourage every New Yorker to get vaccinated, and get the booster if you're fully vaccinated. The edict curbing non-essential surgeries will kick in for hospitals with a limited capacity, defined as at or below 10% of available staff bed capacity. The new protocols will take effect on Friday, Dec. 3, and will be re-evaluated based on the latest COVID-19 data on Jan. 15. The executive order will also enable the state to more quickly any critical supplies to combat the pandemic, she said. Hochul's action comes as her upstate neighbors have been ignoring her pleas to get vaccinated. The upstate regions have both the highest COVID-19 positivity rates and stubbornly lowest vaccination rates compared to New York City, State Department of Health Department data reveal. While advising residents to continue mask wearing indoors and to practice good hygiene and get tested for COVID-19, she added, the vaccine also remains one of our greatest weapons in fighting the pandemic. And this news further emphasizes the need for each of us to get vaccinated and get the booster if you're fully vaccinated. But the COVID-19 positivity rate has been soaring upstate entering the Thanksgiving weekend, while remaining low in New York City. The virus is still lurking among us, said Ayman El-Mahad, dean of the CUNY School of Public Health. The low vaccination rates and high positivity rate upstate is very concerning. The highest COVID-19 positivity rate in the state was in Hochul's backyard, the Buffalo, a western New York region, where 9.67% of residents test positive as of Thursday. Erie County has reimposed a mask mandate indoors to address the flare-up in cases. The 3 days average COVID positivity rate by other regions: Finger Lakes, 8.85%, North Country, Adirondacks, 7.82%, Mohawk Valley, 7.7%, Syracuse, Central NY, 6.46%, and the Albany, Capital Region, 6.96%. Meanwhile, the positivity rate in New York City, where there are strong mandates for government workers to get vaccinated, the positivity rate 1.65%. That's less than half the state's 3.84% average. Elsewhere, the positivity rate is 3.14% in the Mid-Hudson Valley and 4.40% in Long Island, the analysis shows. Meanwhile, the state DOH's vaccine tracker finds there are 18 counties upstate where fewer than 70% of adults have received at least one dose of the coronavirus vaccine. Only 52.9% of adults ages 18 and over in Allegheny County and 57.5% of those in Tioga County, both in the Binghamton, Southern Tier region, got at least one jab. The statewide adult vaccination rate average is 90%. The vaccination rate in Erie County, which includes Hochul's native Buffalo, is 80%, meaning 1 in 5 adults has not gotten a shot. In neighboring Niagara County, 1 in 4 adults are unvaccinated. By comparison, in New York City, 97% of Queens adults and 94% of Manhattan adults are vaccinated, followed by the Bronx, Staten Island and Brooklyn with vaccination rates of 86.4%, 84.4% and 82.9% respectively. A recent CUNY School of Public Health survey of 5 U.S. metro areas found that households with lower incomes and expressing more conservative ideology were strongly linked to vaccine resistance. Elmer had said opposition to vaccination could be a contributing factor to the lower vaccination and higher coronavirus positivity rates upstate. Leaders of all political stripes should encourage their communities to get vaccinated. The more we are protected, the less likely we will see variants, Elmer had said. We have to turn the tide on vaccine resistance. Hochul said she's working with county elected officials and community leaders to raise vaccination rates upstate, including Western New York, but stopped short of calling for a statewide mandate for COVID shots. The governor recently launched a new vaccine incentive program, Take Your Shot, for an outdoor adventure, for hunters, anglers and outdoor enthusiasts. Her office noted that about half of the state's 610 pop-up vaccination sites are located upstate. The state health department is running ads and her administration is partnering with local faith-based community leaders and local health departments to reach the vaccine-hesitant. Meanwhile, the #VaxAndWin partnership with New York's professional football teams, including the popular Buffalo Bills, was specifically designed to appeal to unvaccinated New Yorkers, her office said. Source: nypost.com. Please like, share and subscribe. Thank you for watching.